Address by the Speaker.
Honourable members, welcome and a very good spring morning to you and to all others present in the Council chamber on this, the 24th day of September 2024, to witness this month's proceedings of Minister's Question Time. Thank you for sharing your time with us. The welcome and good morning wishes are extended also to all those who may have tuned their radios to SAMS Radio 1 to listen live to this parliamentary broadcast. The focus for the September meeting of Minister's Question Time is emergency response within the current constraints facing public health and social care, which councillors agreed is the topic for the business to be transacted today. This is in accordance with Order 9, Rule 3 of the Standing Orders of Members of Legislative Council. Also in accordance with Standing Orders, the Chief Minister was made aware of the topic chosen ahead of this meeting, and an hour before Minister's Question Time commencing, the questions that councillors submitted were forwarded to ministers. Established practice has it that the order paper would be published on the SHG website on the morning of Minister's Question Time. 5 councillors are present for this session. 2 are away on CPA business. Councillor Turner, having attended the UK Overseas Territories Project Forum on the oversight of public finances and good governance, held in Westminster, London, and Councillor Thrower, who is participating in the CPA Advanced Parliamentary Development Residency Programme in Kuala Lumpur, Malaysia. We will look forward to hearing all about their experiences when they return. As is usual, the questions have been listed in alphabetical order for selection randomly for response. All of the questions are directed to the Minister for Health and Social Care. Because of agreed amendments to the standing orders, councillors are now able to ask multiple supplementary questions instead of just the one, which was the case previously. Effectively, this makes it possible for other ministers to give support answering questions once the minister to whom the question has been put has acknowledged the original. There are 5 questions to be answered orally, and there is up to 1 hour allocated for this. Based on previous, it should be possible for 5 questions to be asked and answered. However, if it appears that a question or questions is in danger of not being asked due to the time constraint, I would draw members' attention to their standing orders, Order 9, Rule 15. Question may be deferred. I quote, "A question that is not addressed may be addressed at a subsequent sitting," end quote. Just as a reminder, we operate a system whereby a red light is switched on to indicate that a member wishes to speak. Apart from when they are asking questions, members may rise on a point of order or a point of information, and you need to state which. An important consideration is please don't draw the speaker's attention when someone else is speaking. That could interrupt that person, which is an infringement of Rule 15. Ms. Morgan Thomas Henry is our clerk and timekeeper for this session. May we have the first question, please, clerk. Councillor Midwinter.
Mr. Speaker, may I rise on the point of information?
You may, yes.
Mr. Speaker, just to bring to your attention that Councillor Essex is not present in the chamber.
Thank you for bringing that to my attention. I guess I didn't look around the table and didn't see that. But thank you very much. Okay, then can we start?
The Honourable Gillian Brooks.
The Honourable Gillian Brooks.
Thank you, Mr. Speaker. Will the Honourable Minister of Health and Social Care tell this Council what plans are in place for capacity building within the care homes for emergency response situations to further avoid bed blocking within the General Hospital?
Thank you very much. The Honourable Minister for Health and Social Care.
Thank you, Mr. Speaker, and I'd like to thank the honourable member for her question. So it is a two-part answer, really. So the first is what we are dealing with now, which is the short and intermediate term. And currently we are looking at solutions to alleviate this problem through potentially utilising some other SHG buildings. I won't share with the public at this present what those buildings may be, because we are still in negotiations with certain departments and looking ourselves how we do this. So it will look at, for instance, I'll give one example, the utilisation specifically of the physio building, which is attached to the CCC. Because of its close proximity, it would be a fast choice. And then we would look at where we potentially could move that particular service to an area that also, but that service particular will require disabled access, etc. The long-term plans, of course, is looking at what we see not only in terms of the age and demographic, but also what we see in terms of the health of the population. So we are currently, we have just started the policy on the age and demographic, and then their policy will then feed into what we intend to do with future plans. But future plans, just for an example, could looking at reutilising the buildings at the CCC, looking at how we could make space available there, and also looking probably at the areas around the CCC and other care facilities, because what we don't want to do is create another facility where we would have to then restaff the whole thing again. So those plans would be, first of all, driven by what comes out of the policy, but secondly driven by what we can do on the island given our current capacity in terms of staffing. Thank you, Mr. Speaker.
Thank you, Honourable Minister. Councillor Brooks.
Thank you, Mr. Speaker. Thank you, Minister. Can I just ask, Minister, in drawing up the plans, long-term, short-term, everything, is there an idea as yet as to what sort of budget you would need further to help with those plans for you?
Minister Henry.
That is a very good question, Councillor Brooks. No, at the moment, until I think we start to see some of the outcomes from the policy, and given that the policy in doing the policy, we are including other departments. I have a member from Minister Brooks's team there as well to look at the economic impact, etc. No, at the moment, I wouldn't be able to put a finger on the exact or even in the ballpark of what we would need, because we would clearly need engineers and accountants, etc., to help us along those avenues. Thank you.
Thank you very much. Councillor Brooks.
Thank you, Mr. Speaker. Minister, can I just ask, have you set yourself, or your team, a timeline, especially in relation to the long-term strategy?
Thank you. Minister Henry.
Thank you, Mr. Speaker. And just to say that with the long-term strategy, given what comes out of this policy, it is likely that we would have to go to potentially, we would have to submit a business case via the EDIP program or via a separate program to be able to fund the particular project. So that's where we would hit with this particular element. And I wouldn't be able to say what the outcomes or even the feedback from that program would be on these plans.
Thank you very much.
Thank you, Mr. Speaker. Thank you, Minister.
Thank you. Councillor Robert Midwinter.
Well, thank you, Mr. Speaker. Mr. Speaker, could the Honourable Minister say whether in terms of capacity building, which is the highest priority at the moment, is it bed spaces or carers?
Thank you very much. Honourable Minister Henry.
Currently, the highest priority has been, since I started this role, is first and foremost the carers, followed by the facilities. Thank you.
Thank you very much. Next question, please.
The Honourable Ronald Coleman.
The Honourable Ronald Coleman.
Thank you, Mr. Speaker. Will the Honourable Minister for Health and Social Care tell this Council, will St Helena have the staffing or personnel capacities to respond to a major disaster if there was also a serious pandemic at the same time on the island and our hospital is full to capacity?
Thank you very much. Honourable Minister Henry.
Thank you, Mr. Speaker, and I'd like to thank the honourable member for his question. The very clear answer to that is no.
Thank you very much. Minister, or rather, Councillor Coleman.
Thank you, Mr. Speaker. Can I just ask the Minister how the government or him is dealing with it?
Thank you very much, Minister Henry. Or Minister Alec would like to step in.
Thank you, Mr. Speaker. I think this falls within my area in terms of disaster management or major incidents. As part of the Island's COVID-19 preparedness, a standby hospital was built. I think everybody's aware of that. The facility is situated at Bradley's Camp. Although a lot smaller, it has the capacity to care for a further 4 ICU patients, and it also has 10 hospital beds. It has none of the other facilities of the General Hospital. However,
Carry on,
Just
Minister.
allow.
Yeah, thank you.
but we have business continuity planning is in place for the most of the services provided by the hospital. The plan for bringing Bradley's COVID-19 hospital online has been tested during a recent case of COVID-19, which required hospitalization of the patient. We also have the Resilience Forum and clear command and control structures within SHG, with emergency planning exercises being undertaken each year to test our resilience and react to crisis situations.
Thank you very much.
Minister Henry?
I'd just like to follow that up, just to say that clearly, just like other OTs that face other particular disasters, whether it be natural or one of the nature that my honourable friend is talking about, we would then call in the UK government for support, but we can't pin down exactly when or where we would need that support. It would be situational. But there is currently there's conversation in the background just over the past few weeks on how do we establish those terms with the UK government.
Thank you very much. Minister, Councillor Coleman?
Thank you, Mr. Speaker. Can I just ask what they're doing about the staffing and personnel capacity?
Thank you very much. Minister Henry?
Mr. Speaker, I'm not quite sure if this is for this particular question time. Staffing and personnel capacity falls. We need the staff and personnel, but we don't recruit staff and personnel directly through ourselves. That is recruited by HR, etc. And there's a coordinated attempt at the moment, a coordinated response at the moment to help health and social care and other departments with those current needs. I think when we establish those current needs, then we'll be able to project how we'll be able to manage disasters going forward as well, Mr. Speaker.
Okay, thank you very much. Councillor Coleman?
Just to say thank you, Mr. Speaker.
Thank you very much. Next question, please.
The Honourable Elizabeth Knight.
The Honourable Elizabeth Knight.
Thank you, Mr. Speaker. Will the Honourable Minister for Health and Social Care tell the Council what training is in place for staff in any emergency within the hospital, care facilities, and including the Bradley's facility?
Thank you very much. Minister Henry?
Thank you, Mr. Speaker. Specifically, what training is in place on a daily basis, weekly basis, I wouldn't be able to say right now. Given that our department is an emergency response department, that training is ongoing. However, this, it is ongoing. It will largely depend on the specific type of training for the specific type of scenario. So everyday training, what we do or what the staff does to deal with emergencies. For instance, the paramedics does training with our nurses. Likewise, there is also facilities for doctors, etc., to do their I always forget, their career development. So to keep up to date in those areas. But it will depend on the situation, because once it steps outside of what we consider to be acute emergencies, what we can deal with in the hospital, it would then move on to the Resilience Forum to deal with more national emergencies, which brings together a larger group of people. Thank you, Mr. Speaker.
Thank you very much.
Thank you,
Co-
Mr. Speaker.
Thank you very much, Councillor Knight. Put your light off, please. Next question, please.
The Honourable Dr. Corinda Essex.
The Honourable Dr. Corinda Essex.
Thank you, Mr. Speaker. Mr. Speaker, will the Honourable Minister for Health and Social Care state what policy and provision are in place for the isolation of patients having serious contagious diseases to mitigate the risk of further transmission?
Thank you very much. Honourable Minister Henry.
Thank you, Mr. Speaker. I'd like to thank the honourable member for her question. So, let's be clear, the facilities we have are limited, as it has always been, and potentially always will be because of our the number of people and what we can cater for. So it would depend on the exact nature of the infection and the route of transmission, whether it be airborne or, blood, close contaminant. So, it would depend basically on how quick and rapid the particular disease can spread. In terms of what we're doing via a policy, last year, I think if everyone in this room can remember, we had a team conduct the after-action review for COVID. That they then went away and drew together all of the information that we provided and the administration provided in the background. And right now, there is a draft policy in place, which I actually only had sight of last week, in conjunction with the Resilience Forum to deal with future threats. In that draft policy is a section on what is considered barrier nursing, and that particular section looks at specific infections, barrier nursing protocols, and the isolation of patients to prevent the spread of infectious disease within the healthcare system and the wider community, Mr. Speaker. Thank you.
Thank you very much. Councillor Essex.
Thank you, Mr. Speaker. I thank the Ministers for his response. Is the Bradley's facility in a state where it could be stood up to deal with isolation of a patient with a contagious disease if it was necessary to do so?
Thank you very much. Honourable Minister Henry.
Thank you, Mr. Speaker. Like I said at the beginning, if it is one or two patients with contagious diseases, depending on the disease, we would first and foremost deal with that in the general hospital because there is a particular room that is there for that. But there also could be another 2 rooms bought online. And if the disease is the same, then we could put multiple patients in there. However, there will be a trigger point for us going beyond that if there is a widespread of a particular disease, such as COVID, potentially could have been on St. Helena, and Bradley's camp can be stood up within in a short time frame. It would require us taking some of the equipment from the hospital there, but it would be in a short time frame.
Okay.
Thank you, Mr.
very
Speaker.
much. Honourable Minister Ellick.
Thank you, Mr. Speaker. I'd just like to support my honourable friend, because also this is also covered within the National Disaster Plan as well. So within the Resilience Forum, we maintain a subgroup focusing on infectious diseases. And this is overseen by Health to Horizon Scan and test our procedures in such an event. We have to manage a pandemic or large-scale infectious disease outbreak. Also, pandemics and epidemics are covered within the National Risk Register. Therefore, contingency plans are in place, Mr. Speaker.
Thank you very much, Honourable Member. Next and final question, please.
The Honourable Rob Midwinter.
The Honourable Robert Midwinter.
Thank you, Mr Speaker. Mr Speaker, will the Honourable Minister for Health and Social Care tell this Council how well the current paramedic service is working, if this is aligned in any way to the emergency services provided at the airport, and whether any changes are being considered by his portfolio?
Thank you very much. Honourable Minister Henry.
Thank you, Mr Speaker, and I'd like to thank the Honourable Member for his question. So if we just glance back, the professional paramedic service on St Helena is still relatively new and was introduced at the beginning of my tenure. So we are still evolving that service. I can say that it has been a very successful introduction. It has, it is just good to know that when people come to attend you in emergency, they are trained, qualified paramedics. But in terms of the service itself, it has grown from strength to strength. We have two other elements. We cross-train. Our paramedics have trained other services, so they've trained staff from the airport, etc. We also have an apprentice scheme, which are bringing young members through. The response outside of that, they would have to align themselves together. There is also, when we cross with the airport staff in particular, that is just, as far as I know to date, that is usually when we transfer patients from our facility to the airport to be then medevaced or taken out on the flight. So I don't know of any plans at the minute to integrate those services any further. However, if I remember would like further details on it, I can certainly find that for him.
Thank you very much. Councillor Essex.
Thank you, Mr Speaker. The Honourable Minister said that the paramedics are training personnel in other directorates or organisations. Are they also delivering training to nursing staff within the hospital or auxiliary staff within the hospital?
Thank you very much. Honourable Minister Henry.
As far as I'm aware, nursing staff also attended the training that was held at the at the community college on 2 occasions now. So they are being trained in those elements as well.
Thank you very much. Councillor Essex.
Thank you, Mr Speaker. Can the Honourable Minister say if there are any plans for succession planning for the paramedics?
Thank you very much. Honourable Minister Henry.
Thank you, Mr Speaker. As I mentioned in my opening remarks, we actually do have a few apprentices coming through, specifically interested in the paramedic service, which is great news. And, if you do notice now, we do have while we have issues elsewhere, we do actually have a very, a full paramedic service, so to speak, with apprentices. Thank you.
Thank you very much. No further questions. Honourable members, that then concludes the Minister's Question Time meeting for September. Thank you very much for your very valuable contributions. And thank you also to all those in the public who took opportunity to listen to this live broadcast of Minister's Question Time. We trust that you found the questions submitted by councillors on emergency response within the current constraints facing public health and social care and answers provided by the ministers both interesting and informative, and hope that you are now better informed. As is usual, we look forward with much anticipation to feedback from you. In closing, I would like to thank SAMS for broadcasting proceedings live, and all being well, the proceedings will be rebroadcast. Wish you all a very pleasant day ahead. Thank you all very much.